Welcome back to New Age Parenting, and today in Mapping the Conflict, we'll try to find out that what were the myths, and yes, we have the answers, but what are these procedures which can really help couples? And for that, once again, we have Dr. Bindu Garg, fertility expert from Neelkanth Hospital. A very warm welcome once again. Now, people have been wanting to ask is that what are these procedures which we talked last time, but in detail, because connected with those procedures, people have a lot of questions. So you talked about laparoscopic procedures, you talked about IUI. So can we talk more about that?
See, the laparoscopy, I told you, the indications. The main indication is when there is a tubal block. But the success of the laparoscopy, the tubes getting opened after the laparoscopy is not very lucrative. 20% yes, but it depends upon where the block is, at what time the disease process is in advance, and what is the condition of the tubes.
But what happens? How do they get blocked? What is it that blocks them?
Blocks is the fibrous tissue. Once the infection is there and when it heals, there is a fibrous tissue which forms inside, and then it blocks the tube. Now, if there is a connual block at the start of the tubes, there is a guide wire. We put it and we open the connual. It's called as a tubal cannulation, the tubal connual cannulation. And if the block is in between, then yes, then there's no point trying, because then you have to cut the tube and resuture it, which I will never advise as a first line procedure, because there are better options than this. But if the block is in the end, that also we can try, but we never, after the laparoscopy procedure, anytime that you feel that the tubes are not in a good condition, sometimes it can land up into ectopic pregnancy later on when the patient conceives. So tubal cannulation, yes, it has to be you have to judge it, that what are the chances that the tube will get opened, and once it opens, the patient conceives in a natural way. So one indication is that. Another indication which we are mainly doing is for the PCOS. Now the hairy women, obese women, married for 7 years, more than 30. So there is a procedure where we drill these ovaries, which is called as a Leo's operation, ovarian drilling. Again, there are very side effects. Some say it should not be done, some say it should be done. But yes, if given 5 to 6 punctures in that ovary, it is worth trying.
What really is done in that?
We drill these ovaries and then they start ovulating. The hormonal milieu after the Leo's operation becomes in such a way that they start ovulating.
But this is again a laparoscopic procedure?
Laparoscopic procedure, never open the abdomen. Then there is a condition called as endometriosis. Okay. Then we remove these endometriotic spots and we clear the ovaries, we clear the pelvic. So it's basically a restoring surgery for the pelvic organs, and done a good laparoscopy by a good surgeon without traumatizing the organs. The success is very good, and again depending upon the cause. Post endometriosis, and for endometriosis, this laparoscopy does wonders. Done at a proper age, with proper surgeon, with proper the washing of all the pelvic area, the results are very good. But once we feel that after the laparoscopy also the patient is not conceiving, then there is a procedure which is called as intrauterine inseminations. Now indications for this are again many, but mainly it works if there is a subtle, not a severe male infertility. Suppose the counts are, normally they say the counts should be more than 20 to 40. Previously they used to say it should be more than 60. But now the WHO standards, if it is more than 20 and the motility more than 40, even then this sperm can work for intrauterine inseminations. Now what we do is we induce the egg formation in the women, and when the egg matures, we do the serial ultrasound studies. We don't call the patient every day. Now once 2-3 examinations on ultrasound will give us an idea about when the egg will mature. Once the egg matures, we give them a trigger for the ovulation. And then 36 hours later, we take the husband's sample, we call them in the morning, husband gives the sample, go back to the office. After 2 hours, we call the women, the wife, and we wash the sperms. So all the good quality sperms, we inseminate. The chances again become more, 20%, because 20% more than the normal, because you are inseminating the good quality sperms inside the uterus. So they are very near the tubes where the egg has ovulated. The egg, after the ovulation, the egg reaches the tubes, the sperms are very near to the tubes, so again the success is better. This is a condition where it works, and sometimes unexplained infertility also, because we don't know actually what is happening to the sperm. So we make it sure that the sperms are there in the uterus. So this is called as intrauterine inseminations. But again, we don't go for many cycles. We go for 3, 4, maximum 5, but this is not a procedure which is to be embarked upon, that continue IUIs. Once this is also a failure, then yes, then that is the suggestion. Again, we counsel the patient that go for an IVF now.
And is it too expensive? There's
Not
another myth.
Not at all. Laparoscopy is like any other surgery now, and there are so many now training centers, so doctors are well trained for it. So this is also not a very expensive.
And is it a painful procedure?
No, all done under anesthesia. Laparoscopy is done under anesthesia, but intrauterine inseminations is a local. No anesthesia is required.
Dr. Bindu Garg, thank you so much for taking out time and being with us. In fact, we really need to understand that these new age kids who are raring to come and who really have a lot of work to do are coming, even if nature, the way Dr. Garg said, that nature is also at times blocking it, but they're passing through the nature and creating another means to reach out to this world. We really need to actually get up now and take care of these new age kids, because parenting is a little different for these new age kids, but then it's very, very innovative and it can be very, very creative. So till the time we meet again, enjoy parenting. You can call us at our toll-free number 1800-102-6706, or you can mail us at ivf@neelkanthospital.com. You can visit our website www.neelkanthospital.com. Other than the Gurgaon branch, we have branches in Agra, Lucknow and Aligarh.
New Age Parenting, presented by Neelkant IVF Hospitals. We have the experience. Powered by Psychorian Matrimonial, Ek Rishta Vishwas Ka.